Hi, I'm Anissa, and I'm in a group with Sarah and Visser. And today I will be presenting on osteomyelitis. Osteomyelitis is inflammation of bone caused by infection of bone, bone marrow, and the tissue that surrounds the bone. It is more common in males than females to get it, and it may be acute or chronic condition. The symptoms, typically it's kind of hard to diagnose them because it's not easily noticeable, and sometimes it's hard to distinguish them from other problems. But symptoms include fever, swelling, pain, muscle spasms. An acute phase is where patients may report high temperature, chills, fever, increased pulse, nausea, and general weaknesses. And in chronic phase, they may report low-grade fever, fatigue, pain, drainage from a sinus attack. And in the picture, you can see that it's red and it's swollen. Looks painful. This disease is caused by streptococcus, which spreads by having direct contact with an affected person, and it is usually transmitted through a contaminated object that you touch or inhaling infected droplets dispersed by sneezing or coughing. The bacteria spreads through the bloodstream to a weakened spot in the bone. Direct invasion of organism includes a break in the skin, which is usually by abrasions and open fractures, and an indirect is caused by organisms that are transported through the bloodstream onto the bone. And in the picture, you can see that the bacteria gains entrance to the bone, where it grows and forms an abscess that forms along the shaft of the bone, destroying the blood vessels and killing the bone tissues that surround it. So there are multiple ways to diagnose this. The first thing that we will do is take a blood test to elevate the white blood counts, which if it is high, it will indicate that the body is trying to fight an infection, which will typically tell us that it could be osteomyelitis. And x-rays to reveal bone damage, and MRI can be taken too as well to show more detailed images of the bone and the bone tissues that surround it. And we will take a CT if your relative is unable to take an MRI, and a bone autopsy will be done to indicate what type of germ has affected the bone, which will allow the doctor to know which antibiotic to prescribe to kill the bacteria. The first.
You can just close that flash player, sometimes that pops up.
Do I click the X?
Yeah, just the red X, or that's fine.
So the first thing we can do is rest and elevate the foot, or wherever the injury is located. Surgery could be required to get rid of the dead bone and the dead tissues portion of the bone. We could also drain the affected area, remove any foreign objects such as screws, and as a last resort, we may need to amputate the limb to prevent the infection from spreading any farther. Medications could be prescribed, exercise therapy could help, and we will put the limb in a splint to promote bone healing, muscle spasms, and decreased pain. As a follow-up, it is important to have a high diet in protein, calcium, and vitamin C to promote bone healing. It is important to know how to put sterilized dressings on the wound to prevent the drainage. Make sure you follow the treatment plan and know how to administer the medication, and take precautions to avoid cuts, scrapes, or anything that gives easy access to the body. And these are the sources that I use to gather this information, and you can use it as well.